Hi everyone, today we're presenting on iron deficiency anemia on behalf of Alpha Zeta Omega. We're all P2s at UConn. My name is Shah.
My name is Tori Fal.
Hi, my name is Disha Patel.
And my name is Clifford Chen.
To start, I'll be discussing what is anemia. Anemic patients lack healthy red blood cells to carry adequate oxygen to tissues. Anemia is characterized by low hemoglobin levels in the blood. What is hemoglobin? Hemoglobin is an important protein in red blood cells because they're integral to our body's oxygen transport system. It binds oxygen in the lungs and delivers it to tissues throughout the body. When a patient has low hemoglobin due to anemia, our blood supply struggles to distribute oxygen, often presenting as generalized weakness and fatigue. However, there are many different types of anemia. Low hemoglobin may be due to acute or short-term causes such as menstruation or pregnancy. It may also present chronically or long-term in cases such as sickle cell disease. Anemia may be classified according to red blood cell size. To measure this, we use mean corpuscular volume. The three categories include macrocytic, normocytic, and microcytic. Macrocytic anemia means enlarged red blood cells greater than 100 femtoliters. This can be further divided into two subcategories. Megaloblastic anemia means that cells are larger due to abnormal DNA synthesis, often caused by vitamin or folate deficiencies. Histologically, this presents as hypersegmented neutrophils. Non-megaloblastic anemia means that cells are enlarged, but not due to impaired DNA synthesis, but rather membrane defects. Normocytic anemia includes red blood cells of normal size from 80 to 100 femtoliters. Examples include hemolytic anemia and sickle cell anemia. Lastly, microcytic means small red blood cells or less than 80 femtoliters. Common causes include iron deficiency and thalassemia. For the rest of this presentation, we'll focus on iron deficiency anemia. Iron deficiency anemia means that we have low hemoglobin due to lack of iron. Digging deeper into the biochemical pathophysiology, it's important to understand the role of iron in oxygen transport. Pictured on the right is heme, a component of hemoglobin. As you can see, the iron is located centrally in the protoporphyrin ring structure. This iron facilitates electron transfer to reversibly bind and release oxygen so we can pick it up in the lungs and drop it off throughout the body. If we don't have sufficient iron, this process can't occur because we can't fully produce hemoglobin. As a result, tissues will not receive adequate oxygen supply, and the patient will begin to experience symptoms related to iron deficiency anemia.
So for demographics, 30% of the entire world population has iron deficiency anemia. Of that 30%, 17% are premenopausal women and 10% are children in the US population. So for prevalence, 9 to 12% of people with anemia are non-Hispanic white women, 20% in Black and Mexican American women, and 9% of patients older than 65, usually with comorbid GI cancer.
Patients may develop iron deficiency for a multitude of reasons. Generally, these can be categorized into four categories: blood loss, increased demand, decreased absorption, and diet. Because iron is in our blood, when we lose blood, we also lose iron. So examples of this would be the menstrual cycles. Increased demand for iron may manifest through instances such as pregnancy. Growth of the fetus and placenta require a higher quantity of resources than normal, leading to iron deficiency. Decreased iron absorption can occur through GI disturbances such as celiac disease or inflammatory bowel disease, and use of certain medications such as proton pump inhibitors can also decrease absorption. Lastly, diet can greatly contribute to iron deficiency. Vegetarians and vegans may experience iron deficiency anemia because foods such as fish and red meat are high in iron. There are many risk factors for iron deficiency anemia, and many of these can be correlated back to the four main causes on the last slide. Females are at greater risk due to menstruation, due to blood loss, and pregnancy due to increased demand. Infants, young children, endurance athletes, heart failure patients, and cancer patients are at risk due to increased demand for iron. Old age, obesity, and GI disorders put patients at increased risk due to decreased iron absorption. Lastly, vegetarians and vegans are at increased risk due to decreased dietary intake.
Any common symptoms that are presented in patients. The two main groups are symptoms that are internally presented and ones that are externally presented. For internal symptom presentations, the main ones would be extreme fatigue, shortness in breath, being tired, chest pain, headache, lightheadedness, or poor appetite. External presentations would be paler skin, cold hands and feet for a majority of the time, inflammation, and soreness of the tongue and brittle nails.
So the short-term prognosis for most patients is excellent in regard to recovery. However, if iron deficiency anemia is left untreated, the prognosis is poor and can lead to the listed complications listed here, which are heart problems, pregnancy problems, growth problems, depression, anxiety, and more will be discussed about these complications in the following slides. So iron deficiency anemia can lead to rapid or irregular heartbeat, and this leads to the heart pumping more blood to compensate for the lack of oxygen carried in one's blood due to this deficiency, and this can lead to an enlarged heart or heart failure. And this can, however, this can be prevented through iron supplements and prenatal care. And to prevent iron deficiency in infants, mothers are advised to feed their babies breast milk or iron fortified formula for the first year. As the development of the child progresses, their diet should be adjusted so that they have enough iron to prevent the listed issues for pregnancy issues. Adding on to the growth problems that this can cause, severe deficiency can lead to delayed growth and development, and in young populations, it is associated with increased susceptibility to infections. So this results in them having a much weaker immune system. Another problem is that it can also cause individuals to develop depression, anxiety due to low iron levels, and common symptoms of this would be headaches, dizziness, poor concentration, and fatigue. However, iron, or like low iron causes this due to worsened mood. So that's why it's really critical for individuals to have enough iron in their bodies. And the cause of the anxiety is due to some individuals having difficulty replenishing their body with iron through treatment.
In patients with suspected iron deficiency anemia, there are multiple tests to confirm their iron levels and whether they're low. One of the big ones is looking at the red blood cells, and if the red blood cells appear to be smaller and paler, it shows they have low iron. And then you can look at the hematocrit and hemoglobin levels, and if there's a decrease in both those levels in men and women, that would demonstrate they have a loss in iron. And finally, you could also look at ferritin levels, and again, lower levels would indicate. These are some values to some exact values that physicians would use to diagnose someone with low iron. So as you can see for hemoglobin, the normal levels are from 12 to 16. For women and for men, it's 13.5 to 17.5. But if you have anemia, that'd be decreased levels all the way up to severe anemia would be you have a hemoglobin level of 8. And then for hematocrit, they're based on percentages. So these are the normal ranges, and anything under would resemble having low iron. So, for example, for a female, it'd be 36% to 44% is normal, and anything lower would indicate anemia. Finally, for ferritin levels, ferritin is the amount of protein in your body that helps store iron. So again, a lower number indicate you can't store iron. So anything less than 10 would indicate.
Receiving a health screening to know your red blood cell count is considered good practice. This can be done through hematocrit measurement, which shows the proportion of red blood cells in one's blood. Blood is collected in a narrow tube and centrifuged to separate three main layers: red blood cells, white blood cells, and platelets. A technician manually measures the layers and determines the ratio of red blood cells. This generally takes longer because of the manual process, and this type of test is more accessible due to the lack of requirement of intricate resources. Another method is the complete blood count, which indirectly calculates the average volume of red blood cells. This is generally quicker because it is an automated process through a hematology analyzer. This is less accessible because some areas may not have the resources. The U.S. Preventative Services Task Force recommends screening children 6 to 12 months of age and pregnant women, whether or not they are symptomatic. As mentioned previously, normal levels are 45% of red blood cells, and low levels are less than 21% of red blood cells. A false low is possible if the patient has microcytosis, vitro hemolysis, or autoagglutinin.
This chart demonstrates the flowchart of how to diagnose someone with low iron. As you can see, I think the main points to get out of this chart is the red circle part, which says treat any underlying cause, and then immediately start iron therapy, oral iron therapy. So this demonstrates that low iron is always due to an underlying cause, and there's always a reason for the low iron. So the first thing is to find what's causing this low iron. And as shown, if treatment doesn't work, then you must go back to step one of identifying the cause, as the cause you identified before might not be correct, and find another possible reason why the iron is low. And to check if treatment is working, there are various tests that could be used. As shown on this chart, one of the options is doing a monthly CBC, which should complete all the necessary tests needed to see if the patient has low iron. These are the tests to determine the underlying cause, as mentioned in the flowchart. All the tests involved here all check for internal bleeding, but just in different parts of the body. For example, the endoscopy. This procedure checks for internal bleeding from the esophagus to the stomach. It uses a thin line tube that contains a video camera. The camera allows the doctor to look for sources of bleeding anywhere from, like I mentioned before, the esophagus to the stomach. Next, the colonoscopy also uses a thin flexible tube from the camera, except this tube is inserted from the rectum into the colon. Finally, the ultrasound is a procedure that checks for excess menstrual bleeding, which is done through a pelvic screening to look for bleeding.
To prevent the onset of iron deficiency anemia, diet in iron-rich foods is key. Here I've shown different examples of foods that contain significant amounts of iron. As you follow the pictures from left to right across the line, the amount of iron decreases. It may come as a surprise to see that ground beef has less iron than red beans. Other examples of iron-rich foods not shown here include veal, eggs, liver, ham, shrimp, tuna, clams, sweet potatoes, peas, kale, graham cereals, oat cereal, wheat products, strawberries, raisins, figs, tofu, lentils, corn syrup, and much more. These types of food promote red blood cell formation and rebalance the body's store of iron, which prevents the development of anemia. To increase iron absorption from these foods, concomitant consumption with vitamin C is advised. For example, orange juice has a high percentage of vitamin C and can help absorb more iron from one's daily diet. Also, coffee and tea should be avoided as they decrease iron absorption. Depending on the type of anemia that an individual has, there are various treatment options. In the case of iron deficiency anemia, the patient can take iron supplements, make changes to their diet, receive intravenous iron infusions, and receive a red blood cell transfusion. Please be advised that treatment should be discussed with your provider to ensure safe practices and best outcomes. These treatment options will be further explored in the following slides. Iron supplementation is commonly the first step in treating iron deficiency anemia. Normal dosage of elemental iron is 120 milligrams per day in adults, 3 milligrams per kilogram per day up to 60 milligrams in children. An increase in hemoglobin of 1 gram per deciliter after 1 month of treatment shows an adequate response, and therapy should be continued. Side effects of this oral medication include nausea, diarrhea, and constipation, which may lead to non-adherence. To reduce side effects, it can be taken with meals. However, absorption of iron will decrease by approximately 40%. A change in diet is usually advised to all patients with iron deficiency anemia. As mentioned in the previous preventative measures slide, there are various foods that are rich in iron. To increase iron absorption from these foods, vitamin C consumption is advised. Like I mentioned previously, orange juice has a high amount of vitamin C. And as mentioned previously, coffee and tea would decrease iron absorption. For patients that cannot tolerate oral iron supplementation, intravenous iron infusion is the next line of therapy. Patients who have undergone gastrectomy, gastroduostomy, bariatric surgery, or other small bowel surgeries cannot absorb oral preparations, making this the best option. Common side effects include GI effects, worsening inflammatory bowel disease, unresolved bleeding, and renal failure. Iron sucrose, sodium ferrogluconate, and iron dextrin are commonly used. A hematocrit or CBC measurement every 3 months is usually required for monitoring purposes. Red blood cell transfusions are the least common treatment option. Transfusion is recommended in pregnant women with hemoglobin levels of less than 6 grams per deciliter because of potentially abnormal fetal oxygenation resulting in non-reassuring fetal heart tracing. 2 units of packed red blood cells should be given, then the clinical situation should be reassessed to guide further treatment. There are institution-specific guidelines for transfusions for patients with low iron. Generally, individuals that have lost more than 30% of their blood volume will require this type of treatment. If you have any questions, please feel free to contact one of us. Our emails are listed below. Thank you for watching this presentation, and these are our references.